heart rate is roughly between 60 to 100 beats per minute. Tachycardia, a fast heart rate, is greater than 100 beats per minute, and bradycardia, a slow heart rate, is less than 60 beats per minute. Okay, so let's talk about the methods of interpretation. Before we do so, you might be aware that kind of a maximum heart rate is roughly 220 minus your age. Yeah, and we want to determine if the patient has a normal rate or if they're tachycardic or bradycardic. If they have a regular QRS rhythm, that's why it's important to work out the rhythm first, whether it's regular or irregular. We can do 300 divided by the number of large boxes between two successive QRS complexes, so the RR intervals. So if we look here, for example, between this R wave and this R wave, we have 1, 2, 3, 4. We have 4 large boxes, therefore the rate is going to be 300 divided by 4, which is roughly about 75, I think. And then if we have an irregular QRS rhythm, so for example in atrial fibrillation, we can do 6 times the total number of QRS complexes in the rhythm strip. So again, that's typically lead 2. So if we count the number of QRS complexes, we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, times that by 6, which is, that 70-ish. I think it's about 72. Okay. And the methods what I've just mentioned of determining ventricular rate, atrial rate can also be calculated by doing the same for the P waves. And atrial fibrillation is a good example where atrial rate and ventricular rate can significantly vary, because atrial rate can be anywhere greater than 300 beats per minute, and the corresponding ventricular rate can either be, it can be slow because you can have slow AF, or it can be very, very fast, typically in young people. And I mentioned this in my video about atrial fibrillation, where that's called a rapid ventricular response, where we tend to have a high ventricular rate in response to that, a high atrial rate. So that AF is a good example of reasons why you might want to calculate the atrial rate too. Although that might actually be difficult, because on the ECG trace itself, feature of AF is that there aren't any discernible P waves, so that I'm sure there'll be another method of doing that. Okay, so now let's talk about axis deviation. So what is the cardiac axis? So the cardiac axis represents the mean direction of ventricular depolarization in a frontal plane. Okay, so in a frontal plane. A normal cardiac axis is between -30 to +90 degrees. And my personal favorite method to determine if there's any axis deviation, or if the axis is normal, is the leads 1 and AVF method. Other methods include the isoelectric QRS complex method, and I suggest you have a look at this in your own time. I personally prefer the leads 1 and AVF method. So what you want to do is you want to determine the deflection of the QRS complexes. In other words, which way does the R wave point of R wave of the QRS complex point? Does it point upwards, or does it point downwards? Upwards representing a positive deflection, downwards representing a negative deflection. Okay, so if there's positive deflection in both leads 1 and AVF, that suggests that there's no axis deviation. That's a normal cardiac axis. If there's positive deflection in lead 1 and negative deflection in AVF, that suggests that there's left axis deviation. If there's negative deflection in lead 1 and positive deflection in AVF, that suggests that there's right axis deviation. And if there's negative deflection in both leads 1 and AVF, that suggests that there's some extreme right axis deviation. That can be seen typically in quite severe right ventricular hypertrophy. Okay, so let's look at an example. So we're going to use the leads 1 and AVF method. We can see that there is negative deflection of the QRS complexes in lead 1, and there's positive deflection of the QRS complex in AVF. Therefore, we have right axis deviation. Okay, so this is an example of right axis deviation. There's various causes of right axis deviation, and left axis deviation, etc. And we're going to detail them in future videos, as this is an introductory video. But generally some causes of right axis deviation, right ventricular hypertrophy, a right bundle branch block. You can have right ventricular strain, so strain on the right ventricle due to lung pathology such as pulmonary embolism, COPD, pulmonary hypertension, or stenosis of the pulmonary valve. Even arrhythmogenic conditions such as Wolff-Parkinson-White syndrome, etc. So this is to summarize. This is an example of right axis deviation.